What is the role of a physician in the public social media, not necessarily in the sort of private physician-only networks?
So when I talk to physician groups, I tell them that social media and cyberspace is where your patients are and where you need to be. And I think that's there for a couple of reasons. One, I think that social media as a physician gives me the opportunity to educate mass number of people about ways that they can better their health. I can engage patients. There's lots of data out there that says if I engage a patient in their own health care, be it managing their blood pressure, managing their blood sugar if they're diabetic, outcomes improve. Also, I can help motivate patients to connect with one another and continue to learn about their disease process. I find that Twitter is particularly effective because it gives you the opportunity to make a quick statement and then link to an article or a video or something else that can have that patient spend a little bit more time interacting with that.
Nice. Nate, so even in a physician-only social network, beyond the networking of them professionally, how do they discuss patients in those networks? Are there patient discussions between physicians? How are they sort of?
Yeah, that's a great question. So we agree that medicine is absolutely a team sport. And in the long run, we need to find a way through a constellation of services to be able to include everybody in that team in the process. And we can go into more detail on that later, but in a nutshell, doctors are doing on Doximity what they would do today, but just much more efficiently. So our early adopters, interestingly enough, were in places like Alaska and Montana, and it's because those doctors were lonely, and they had nobody to help with a really tough case. But if you think about New York Presbyterian Hospital down the street here, that's a very dense environment. And so the benefit of a network that says maybe like 10% of all doctors, it's hard for you to really find a reason to join that kind of network and discuss your patients on that kind of network because you got all your buddies right next door. And so it's not until you reach a certain level of saturation that it really blossoms for sort of some of these intra-hospital patient discussions rather than extra-hospital referrals and exchange of broader knowledge.